More than 23 million Americans have now received at least one dose of the COVID-19 vaccine. Almost 700,000 of those here in Ohio, putting the state, though, among the worst in the nation for the vaccine rollout. Good evening, everyone. I'm Colleen Marshall.
Hello, I'm Kerry Charles. The CDC's vaccine tracker shows the Buckeye State ranks near the bottom in getting its population protected from COVID-19. NBC4 investigates Jamie Ostroff had to know why. She took her question straight to one of the doctors leading the coronavirus response here in Ohio. What have you learned?
Well, I learned that Ohio sits at 47th in percentage of population that is fully vaccinated. Dr. Bruce Vanderhoff told me a big part of the reason why is sitting in Michigan. Ask people around Columbus, and their COVID-19 vaccine can't come soon enough.
I'm looking forward to it.
I'll get it right away.
The CDC tracks how quickly needles are going into arms across the nation. Less than 1% of Ohioans have had both doses of a COVID-19 vaccine. But just across the Ohio River, more than 3 times that percentage of West Virginians are fully vaccinated.
Our purpose was to get vaccines in the arms of as many people as possible.
I asked West Virginia's COVID czar why his state tops the CDC's rankings. Dr. Clay Marsh said the state hasn't used the federal vaccination program, which relies on corporate pharmacy chains to get doses into nursing homes.
About half of our pharmacies in our state were independently owned and operated. So we created a network of relationships between pharmacies, which handle the vaccine for us.
As a result, the CDC reports most of West Virginia's available doses have been used. Ohio, which participates in the federal program, has used only half so far. I asked Chief Medical Officer Dr. Bruce Vanderhoff why so many doses are going unused while so few Ohioans have been vaccinated.
We have doses which are sitting in Kalamazoo, Michigan.
You're saying a large portion of that 52% is sitting in Michigan right now?
So a large portion of what would show up in their tracker are actually doses which have been earmarked for Ohio, but are not yet physically in Ohio.
Part of the initial concern, Vanderhoff said, was making sure people in nursing homes can get their second shot. That's where those vials in Michigan will go once they get here.
We also happen to have, for many historic reasons, a much higher nursing home occupancy per capita than most states.
Given the short supply of vaccine impacting every state, Vanderhoff said he's happy with Ohio's approach. So are the Ohioans I spoke with.
I think they're doing the best they can. I think as a country, it's not really quite going at the rate that it should be.
Every vaccine that gets into somebody's body is a step in the right direction.
So the federal government has agreed to pick up the pace in Ohio. Governor Mike DeWine announced Tuesday that 77,000 of the doses sitting at Pfizer's facility in Kalamazoo, Michigan, are coming to Ohio and going into arms in the next 2 weeks. But that wasn't supposed to happen until March.
A lot of people surprised by all of this, for sure.